1 out of 5 women in India suffer from Polycystic Ovary Syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Susheela, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Hello Sania ji, I am really very happy to answer your question. Yes, definitely, because we are finding obesity is a major part in the PCOS. Almost 40 to 70% patients are obese in PCO. So we advise them to take calorie requirement little less so that they can reduce weight. Not only the portion, the quantity and quality, because we have to give the less of calorie in these patients. So they have to reduce their portion. At the same time, we want there should not be any deficiency of any minerals, vitamins or diet factors. So we advise them to take low carbohydrate diet, and fat content is also less so that they can reduce weight easily. And it has been seen that even the 5% weight reduction helps in PCOS patients to revert back to their normal hormonal balance.
Thanks, Doctor. Can you also share how crucial is physical activity in the management of PCOS?
Yes, hello Sania ji. Yes, lifestyle modification is very important aspect in PCO patients, and it has been seen when we advise exercise to them and they are living an active lifestyle, then BMR is increased and hyperandrogenic features they get reduced, and insulin resistance is also reduced. It has been seen sometimes just adding the exercise, they return back to their normal periods, and acne, hirsutism, they also reduced. And most of the time we advise that 150-minute exercise in a week should be there, and if patient is doing regular exercise in 30 minutes per day or 5 days in a week is good enough.
Thanks, Doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
Yes, hello Sania ji. Yes, monitoring is very important aspect in PCOS, because PCOS there are different problems in the different stages in the PCOS. Like in early ages, patient can have irregular periods, and later on she may find that she is not able to conceive, and in later life, in the middle age, she can develop diabetes or hypertension, and later on endometrial carcinoma and so on. So we have to be investigating or monitoring for all these type of the problems. Like we want to check their glucose metabolism, like sugar OGTT test or lipid profile according to the obesity, BMI, whether patient is having a lifestyle healthy or reducing weight or not. And sometimes few hormonal tests like thyroid is associated most of the time PCOS patients. So we just advise them to monitor and the different stage and the different level, and we just keep on monitoring, and whatever level they are deviating from the normal range, then we try to take treatment for that. Thank you.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Susheela, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.